In today's program, we're going to talk about 3 medical approaches: acupuncture, needle medicine; lasers, a light beam scalpel; and homeopathy, the art of minute doses.
In the West, great efforts are being made to bring mind and body, energy and matter, man and the environment closer together. This trend towards totality or holistic medicine has existed for thousands of years in Oriental tradition. Take Chinese medicine. The basic principle underlying the Chinese approach is that the world is governed according to a 2-stroke rhythm. That is an alternation of yin and yang. The yin is associated with passivity and the yang with activity. The Chinese also believe that this binary rhythm regulates how the human body works. Heartbeat, alternation between expiration and inspiration, cellular metabolism. Man is a microcosm, a reflection of the universe, the macrocosm, and he must be in harmony with it. As soon as man commits an error in his relationship with the universe, he gets sick. Chinese medicine is very specific when it comes to treatment. It uses acupuncture needles.
Acupuncture is one of the most ancient forms of medicine in the world. For a long time unknown or ignored in the West, acupuncture is based on a way of thinking that is not easily grasped by our traditional Western scientists. Energy flows through the body continuously. If there is an imbalance in the flow, disease develops. The role of the acupuncturist is to detect the flow of energy, make a diagnosis, then re-establish the energy balance. But what exactly is this energy that doesn't even flow through the central nervous system, veins or arteries? It is simply electricity, which travels along longitudinal lines called meridians. The human body has 14 main meridians, symmetrically placed on either side of the body. Each meridian corresponds to an organ or to a vital function, and on each meridian there are access points called acupuncture points. It is on these points, located all over the skin of our bodies, that the acupuncturist will insert the needles to restore the balance of energy. The acupuncture points, which follow the energy flow lines on the skin's surface, are not necessarily located near the organ to which they correspond. For example, the meridian that corresponds to the large intestine starts at the index finger, travels along the arm, and ends at the nostril. The targeted organ is reached through acupuncture points by another energy network, this one hidden inside the body. The number and location of acupuncture points are identical for everybody. There are 365 main points and some 600 secondary ones. They are all located in tiny slopes formed by spaces between 2 muscles or bones. They are easily found by measuring their electric resistance, which is weaker than on other areas of the skin surface. By stimulating the acupuncture points with needles, the acupuncturist can restore the balance of energy flow in a diseased organ. But before treating the illness, the acupuncturist first makes a diagnosis. Unlike Western medicine, in acupuncture the pulse is taken with 3 fingers, and there is a pulse that matches each organ in the body. The acupuncturist then examines the patient's tongue and skin coloring. If the doctor detects a functional problem, a liver dysfunction for instance, he can intervene. If, on the other hand, he detects a serious lesion, there isn't much acupuncture can do. Indeed, acupuncture is especially useful in the case of functional disorders, such as bronchitis or gastroenteritis, but it cannot replace surgery. Clinical studies have ascertained the effectiveness of acupuncture, particularly when used to regulate blood pressure and for local anesthesia. But scientists don't understand fully how acupuncture works. However, a meridian has been located by injecting a radioactive liquid in an acupuncture point in the heel. Thanks to a radioactivity-sensitive camera, it was possible to observe the route the liquid followed, which was through all the acupuncture points as expected. During surgery, acupuncture is used as a method for administering local anesthesia. In the case of a lesion in the neck, for instance, the doctor inserts needles on strategic points around the lesion, as well as on regional meridians. Once the area has been anesthetized, surgery can begin. Scientists have discovered that when certain acupuncture points are stimulated, the brain secretes an anesthetic substance. This chemical substance, called enkephalin, has properties similar to morphine and can effectively control pain. An even more recent technique is currently being used by acupuncturists. It involves stimulating acupuncture points with a laser beam. When a low-intensity laser beam is directed on the points, they become stimulated just like when needles are used. This particular treatment is much faster. It takes only a few minutes. Laser acupuncture is less traumatic, especially when the patient is a child, or if the intervention is being done in a sensitive area of the body. Scientists are still trying to understand the process involved in acupuncture. Meanwhile, its clinical use is becoming increasingly tried and tested.
Who needs needles or lasers? Here on either side of your nose, just below your eyebrows, there's a little notch in the bone. When I have a headache, I press down gently, and in a little while, I feel much better. Shiatsu is acupuncture without needles, a massage technique invented by the Japanese. It restores the balance in energy flow with the exact same map of meridians as acupuncture. But our hands couldn't possibly replace lasers in some cases. The laser was invented about 30 years ago. Initial research on lasers was linked to developing particle beam weapons. But researchers soon realized that a laser beam could pinpoint specific cells in the human body and destroy them with extraordinary precision.
Today, the laser is used for numerous medical procedures, cauterizing ulcers, destroying tumors, even dealing with sensitive organs like the eye. The light of a laser beam owes its power to a unique property. Ordinary light from a light bulb or the sun, for instance, consists of different wavelengths and colors that move at random and in all directions. The light emitted by a laser is coherent, has only one wavelength, moves in phase, and is highly directional. What gives the laser beam its power is the phasing of its rays. There are several types of lasers: gas lasers such as argon lasers, solid ones such as ruby lasers, and liquid ones such as alcohol lasers. Regardless of the material used, the basic principle remains the same. Take the case of a ruby laser. A red ruby, whose end surfaces are perfectly parallel, is inserted between two mirrors. One of the two mirrors has a reflection coefficient inferior to the other. A lightning tube, producing a very strong white light, envelops the ruby. A very brief but bright flash of lightning excites some of the ruby's atoms. As they return to their stable state, the atoms produce photons, the basic particles of light. A chain reaction ensues, producing more and more photons. The photons are then sent back and forth along the ruby by reflection in the two end mirrors. This creates waves of identical length, which are in perfect phase. The emitted beam, the laser, is strong enough to break through the partially reflective mirror at one end. The laser can be used in ophthalmology to treat patients suffering from glaucoma. This disease is characterized by an accumulation of liquid in the eye, resulting in excessive pressure on both the optic nerve and retina, and in reduced peripheral vision. Thanks to lasers, glaucoma can now be treated quickly and painlessly right in the eye doctor's office. The ophthalmologist first uses a harmless laser beam, which enables him to focus on a very specific area of the eyeball. He then directs a second laser beam on the targeted surface. This beam, which is stronger than the first, will only be directed for a few billionths of a second. On impact, like a scalpel, the laser's coherent light cuts a minute incision on the surface of the eye. The incision lets a small quantity of liquid drain from the eye and relieves the pressure in the eye. While used for skin and eye surgery, the laser cannot directly reach organs inside the body. Like all other forms of light, it is blocked by opaque surfaces. Optic fibers are used to get around this problem. Optic fibers are minuscule, flexible glass wires, as fine as human hair. The wires can transmit very powerful light beams. Optic fibers enable laser beams to penetrate the body and help illuminate the targeted tissue. For surgery on the esophagus or intestine, for instance, a device called an endoscope is used. The endoscope consists of optic fibers which transmit light to the targeted regions. The light is reflected by the inside surfaces and is immediately picked up by other optic fibers, which send the image obtained onto a lens or video screen. Using controls, the surgeon is able to guide the end of the endoscope directly to the targeted tissue. Then a laser beam is sent through another optic fiber to the area requiring treatment. What the laser beam mainly does is to heat up the water molecules contained in the cells. The cells become like little kettles. Very quickly, the water molecules reach the boiling point and begin to evaporate. The pressure inside the cell increases to the point where the cell bursts. The precision of the optic fiber images, together with the effectiveness of the laser, have simplified and in some cases replaced a good many surgical procedures that used to be complex.
Lasers and optic fibers have revolutionized 20th century medicine, but this new technology is costly and is only used to treat very specific problems. Western medicine is often accused of having a fragmented approach to health care. Patients consult the ophthalmologist, the cardiologist, the ear, nose, and throat specialist. Homeopathy, like acupuncture, is a holistic medicine, focusing on the patient as a whole person rather than on disease as a string of symptoms to be eliminated. Homeopathy takes into account the physical and mental state of the patient, his past, his present. Homeopathy originated in the West. It was developed by Heinemann, an 18th century German toxicologist. Homeopathy considers the patient as an individual who needs individualized treatment.
bee venom to cure skin rashes, mercury to regulate the urinary system. No, these aren't just old wives' tales. It's a serious medical approach called homeopathy, based on a biological principle, the principle of similarity. For instance, if belladonna is taken by a healthy individual, it will cause him to sweat, run a fever. He may even develop rashes on his face. But if a baby has a severe chill or a woman a bad sunstroke, both will show those symptoms. According to the principle of similarity, belladonna will cure them if it is given in extremely small doses. But how can plant, animal, or mineral substances, normally toxic if taken in large doses, actually cure an illness? Symptoms that develop as a result of an illness, such as fever, are normal bodily reactions to an invading microorganism. In fact, fever is an indication that the body is fighting the illness. Homeopathic medicine works similarly to the way our body does. Rather than countering the normal process causing the symptoms, it prods it along to make it more effective. Rather than eliminate the fever, like aspirin does, for instance, homeopathic medicine stimulates the mechanisms that enable the body to combat the illness. But it is important that homeopathic medicine be administered in very weak doses so as to only stimulate the patient. Doses that are too strong could make the patient's condition worse. Weak doses are obtained by a process of dilution. The plant, animal, and mineral substances used to make homeopathic remedies are first soaked in alcohol for a few days. The solution obtained is called a concentrated tincture. This tincture is then diluted several times and vigorously shaken in a special device. Each time the solution is diluted, its concentration diminishes 10 or 100 times. Through the dilution process, a whole series of dilutions are obtained, ranging from 1,000th to several billionths of billionths. Different concentrations of a same substance are thus obtained. When diluting the solutions, very pure solvents are used, usually distilled water or 70% alcohol. The dilution process must also be done in a controlled environment to ensure that dust particles do not come into contact with the solutions. The ambient air contains pollutants that are far more concentrated than the homeopathic medicines under preparation. The pollutants might contaminate the alcohol or distilled water. They would then become soluble and diluted with the homeopathic substance. The air in laboratories where homeopathic remedies are manufactured is filtered and virtually free of undesirable particles. There currently exist more than 1,000 homeopathic remedies, each one obtained at different degrees of dilution. These come in the form of drops, which can be mixed with water, or pellets impregnated with the homeopathic solution. Usually, the more a patient is sensitive to an illness and the stronger the symptoms are, the more diluted the medication will be. In homeopathy, dosage is determined by degree of dilution. And because homeopathic medicine is diluted, unlike conventional drugs, it is non-toxic. But homeopathy has its limitations. In order for it to be effective and to stimulate a reaction, the patient has to be strong enough to react. In other words, the illness must be benign, and the patient must be able to combat it. Homeopathy is obviously not effective in the case of irreversible lesions. But the scientific and medical community is far from unanimous with regard to homeopathy. One of the main arguments voiced by its detractors is its high degree of dilution. If a homeopathic solution has been diluted too many times, the final remedy may no longer contain a single molecule of the active substance. How then can it possibly be effective? While the controversy continues, Homeopathy is gaining ground in the West. In fact, in France, almost a third of the population puts its trust in homeopathic medicine.
Our bodies don't forget a thing. Every bit of stress, suffering, or conflict is imprinted in there somewhere. We simply have to know how to read. Many times when we see a doctor, any kind of doctor, the first thing we expect, even before treatment, is that we be looked at, listened to, and touched. Body, mind, energy, matter, high-tech or holistic medicine. Do we really have to choose?